Hello, everyone. This is Dr. Sudhir Rao from Pain and Spine Specialists. I want to take a few minutes to let our Medicare beneficiaries know all that they have access to. I find that we're at an unusual time in medicine where Medicare now has approved many different treatment options and services to make sure that Medicare beneficiaries get the optimal level of care, which I think is fantastic. So to start with, there's a concept or a service called chronic care management. So chronic care management is a program that Medicare came out with because they recognized that too many people were getting sick and ending up in the hospitals. So Medicare has encouraged physicians to take an extra step on interacting with patients when they're not in the office to address new issues that may come up, sometimes address issues that were forgotten or not discussed or not clarified. So whether it's a medication-related problem, it's, hey, when is my next procedure? What are my treatment options? My friend had something that they have told me about that may be something I may be able to be eligible for. Instead of having to wait to your next appointment, we can have discussions offline in between appointments by phone to check in with you, to make sure that we're addressing all the concerns that you may have. And if there's new issues, we can address them as well. So that's called chronic care management. We have a team that of providers as well as techs that can work together, reach out to you and communicate those concerns to your providers. The providers can then come up with solutions or treatment options while you're not in the office, and or contact you, or sometimes we will bring you back in the office sooner than expected to address and figure out what needs to be done. So chronic care management has been very effective in helping to reduce hospitalizations, reduce people having side effects to medications or other problems, and hopefully keeping patients happy with the level of care they're getting and giving them extra access to the providers when sometimes they may feel like they don't have as much. Behavioral health integration or collaborative care is a similar concept for behavioral and mental health concerns. We have a similar team in place, and we have a psychiatrist that we work with who will review these concerns, whether there are questionnaire-related questions, there's medication-related questions, or just issues in general. We can then figure out how to address them, and sometimes we may need you to refer you out to another specialist. We may need to be able to have you come back in to see us, or a combination of all of those options. But the goal is to be able to keep in touch with you and give you more resources than we used to be able to do in the past. From a procedural standpoint, we have several different procedures that Medicare beneficiaries may benefit from. First of all, ViaDisc. ViaDisc is a disc injection for degenerative discs. As time goes on, our discs start to become dehydrated and the integrity of the disc weakens. And what that does is it causes for a collapse of the disc, and the nerves around those discs can get inflamed and irritated, can give us back pain, leg pain, numbness, and tingling. When epidural steroid injections do not do enough or don't get you the type of relief that you want, and you want to avoid surgery, then we would consider the ViaDisc as another option. It's a simple 5 to 10 minute procedure. We do it at the surgery center to maintain sterility and decrease the risk of infection. We enter the disc and we inject the ViaDisc material to improve disc integrity and rehydrate the disc itself. It's been approved for over 18 months, and we're getting good results. The next option would be the Aurora Zip procedure. This is a procedure for patients who have spinal stenosis or narrowing of the spine itself. When epidural steroid injections do not help, physical therapy does not help, the MRI shows moderate to severe central canal spinal stenosis. That says that the nerves do not have enough room to come down and out. So when you stand or walk, the pain increases. When you bend forward or sit, the pain lets up. Then you may be a good candidate for an Aurora Zip procedure. The next option is sacroiliac dysfunction. So SI joint pain, sacroiliitis, or SI joint dysfunction is where you have low back, hip, groin, back, and leg pain that does not respond to other treatments. We can put injections of steroid and anesthetic into the SI joints, and if it gives you temporary relief, then you may be a candidate for an SI fusion. If we can fuse that joint through a percutaneous or minimally invasive approach, we can then decrease the movement in that joint, which should decrease the pain. Peripheral nerve stimulation is another option as well. So for patients who have had chronic shoulder pain, hip pain, lower back pain, even after surgery or after spinal cord stimulation, and or knee pain after surgery. So shoulder pain after shoulder surgery, or you're not a candidate for surgery, hip pain or lower back pain after surgery, or knee pain after surgery, or you're just not a candidate for surgery, then peripheral nerve stimulation may be a great option. What's exciting about peripheral nerve stimulation is that we get to identify the specific nerves that we think are causing the problem. We do a nerve block, we see how much better you get. And if you get temporary relief, then we can do a trial where we put a wire around those nerves and stimulate them. We do that for 3 to 5 days and see what type of response you get. And if you get good response, then we say, great, we're going to go ahead and implant this device. And the device is tiny. We put the wires in, the battery pack itself is pretty small, and it gets internalized. And the goal is to stimulate these nerves to decrease pain to get you feeling better. The Intercept procedure is a newer procedure as well that can help with axial back pain, pain in the vertebral bodies themselves, so in the bones, and we access the bone of the spine, and we can keep the nerve that's in that bone that may be causing back pain that has not responded to other types of treatment. So it's exciting that we have lots of different services and treatment options for Medicare beneficiaries. I want to make sure that if you or your loved ones have Medicare, please ask us and inquire about what else we could do to help you enhance the quality of your life and improve your overall outcomes.